Good morning, dear students. A warm welcome to all of you for our today's digital session for the subject Science and Technology Section B. In our previous session, we have started with the topic of disaster management from chapter number 9, Environmental Management. We had got ourselves introduced to the term disaster. What is a disaster and the two types of disasters? In today's session, we are going to learn certain techniques which are very useful in controlling or managing the disaster, and after a disaster occurs, what first aid you can provide to the victim, or how emotional and mental support you can give to the disaster affected victims. Before that, as usual, we are going to revise the topics which we have studied in our previous session for the first 5 minutes. So our first topic for revision is the 7 principles of solid waste management. As we have seen that management of solid waste has become the need of the hour, and it is very important. So the first principle here is reuse. Different examples we had seen last time. The word itself tells it. Reuse means after use the materials should be again and again used for some other purposes. And here very simple example I had told you. If there are 2 kids in the house, one is elder, one is younger, the textbooks which are used by the elder kid and the portion remains the same can be again reused by the younger kid. So the books should be maintained in a good condition. If the books are not, if the 2 kids are not there in the house, then there might be some neighbors or poor children who do not have that financial capacity to purchase the books from outside. So that textbooks which are in good condition can be provided to them. In this way, reuse is the first technique. Refuse. Refuse to what? Refuse to use the articles which are made from non-degradable materials like plastic and thermocol, because we have seen how much amount of time is required for the degradation, lakhs and lakhs of years for plastic and thermocol to get degraded. The next is recycle. There are certain, you can say, articles which can be produced from the recycling of solid wastes. For example, paper and glass can be recycled and used. Rethink. What you have to think upon? You have to think upon your own ideas, your habits, your activities, what you are using, whether your use is putting our ecosystem, our environment in trouble, or the things which I am using are beneficial for the environment. Reduce. Here you have to reduce the use of natural resources so that they will not get wasted and will become available to our future generations. At the same time, one thing should be shared by many people. Use and throw type of objects should be avoided. Next is research. This is very important. Conducting research related to the reuse of materials which are temporarily out of use. Regulation and public awareness which can be done at our level. As small kids, you can follow all the laws and rules which are given to us by the government from time to time related to solid waste management, and once you start following, you can motivate and encourage the people around you, the community around you, to follow that techniques and make our environment pollution free. The next was 3R mantra. R. Again, the principles which we have studied under the principles for controlling the solid waste. Out of that only 3 R's are there. One is reduce, reducing the waste. Why 3R? Because the 3 techniques starts from R. Next is reuse of the waste, and recycling of the waste. Then some steps we had seen which will help us to keep the environment pollution free and keep the environment or preserve the nature's beauty. The first habit is throwing plastic wrappers of chocolates, ice creams, biscuits, etc. into the dustbins and avoid their littering. Here different examples we had seen last time. People, how they eat the things on the seashore, in the gardens, in the parks. So the wrappers of the chocolates, the plastic bottles and all are just littered around in the ground, which spoil the beauty of that, you can say, place which is meant for entertainment. So don't do that. Instead, there are dustbins which are placed at different places, so you can make use of them. Next is avoiding the use of plastic bags and instead using cloth bags or bags which are prepared from old saris, bed sheets, curtains. Here you will be benefited in two ways. One is there will be automatic reduction on the use of plastic, which is very harmful, and at the same time our reuse technique can be followed, because the old saris, the old bed sheets which are of no use, that can be put into use again by preparing bags from it. Next is using both the sides of the paper for writing and reusing greeting cards and gift papers. Avoid using of tissue paper and prefer to use one's own handkerchief. Here I have told you, handkerchiefs are made up of cloths, they are made up of cotton. So once used, you can wash and reuse them. If you are making use of tissue paper, it will be just use and throw, and it will contribute to the accumulation of solid waste, which should be avoided. Using rechargeable batteries instead of lead batteries, implementing various programs of solid waste management, and educating, encouraging the family and society in this regard. Now the people, really there are many people who are uneducated. They do not know how dangerous the accumulation of waste can be to the environment and to themselves. So different small techniques which are used, which are implemented at your level. If you see some tap leaking or the water just flowing away, you can close the tap. If you see any people throwing the things around in the gardens, in the trains, you can just tell them in a very soft tone the harmful effects which can be caused because of just throwing them away. Instead, they can just put it in the purse or bag and later on dispose of in the dustbin. Avoid using throw type articles like pens, canned cold drinks, tetra packs. Their use should be strictly avoided. So this were the different small habits which can be inculcated by us, and we can encourage the society and the people around us to follow it. Then we had seen what is disaster and the two types of disaster. The two types of disaster were natural and man-made. The disaster which is caused by natural factors like tsunami, earthquake, landslides, etc. is called as a natural disaster, whereas a disaster which is brought about by different human activities, unwanted human activities, is called man-made disaster, which includes different wars, fire accidents, leakage in the chemical factories, industrial accidents, etc. After that, we had seen different pictures of different disasters. Now, disaster has taken place. Either it will be natural, either it will be man-made. How you have to put a check on its after disaster or the after effects, that we are going to study in this part of the chapter. So our today's new topic is main part of the disaster management. Now how this management of disaster is carried out? It is carried out, or it is the action which is implemented through proper planning, organized activity and coordination. You have heard, after a disaster occurs in any place, immediately the victims over there, they get the help from the different NGOs or the different government based organizations. So randomly do these organizations or the people run and help the victims over there? No. Somewhere this activity, this management techniques are well planned by the people who are engaged in this part. So what part is included under disaster management? First thing is proper planning, because the after effects of each and every disaster is different. After an earthquake, the victims, you can say, they are mentally, emotionally imbalanced. So during an earthquake or after an earthquake, the people has to be shifted to a different place. After a fire accident, the after effects are different. After tsunami, the effects are different. So each and every disaster is different. So proper planning for each and every disaster has to be made, organized activity, and main thing is coordination among the members who are a part of this management. The different participants you can see here: government, the main, auditor, telecom, because different social media are engaged in helping out in the disaster management techniques. Shelter, the victims have to be mobilized to a shifted to a proper place. Proper shelter should be given to them. So on the spot you cannot decide. So beforehand all these things have to be planned out. What medical service you can provide to the victims? Medical supplier, the you can say vehicles, vans, ambulances which are used in it, transporter which will be very important for transporting the victims, and used in the transport of food materials, water to the victims, food supplier, the residents. So these are the different participants in disaster management. Now the next points will tell us how the techniques or how management is carried out, in what ways, what it includes. The first is prevention of losses and danger. Why this management action has to be carried out very immediately? After a disaster, depending upon the intensity of the disaster, how serious it is or how mild it is, every disaster has some loss. It creates some loss. So prevention of loss, maximum loss, to prevent that and to prevent the danger, that is the main part which is included in the disaster management action. Next is improving tolerance. The people, they become very wild. The victims, they become very wild. Each and everyone tries to save their own life. There are certain disasters which take away everything from the people's hands. Chipron, Mahad disaster which we have witnessed very recently. You can see the people there, they were saying that we have lost everything. So there they become very intolerant. To improve their tolerance level is the next step. Providing relief from the disaster, minimizing the intensity and the extent of harm. Again related to your first point only, immediate relief from the disaster is the main step here. Preparation to face the disaster. The preparation of this management team to face the disaster. Any disaster can strike. So how each and every disaster can be faced, that preparation should be checked from time to time. Immediate action in the disaster situation. Today an earthquake has taken place. After 10 days if you try to help the people, then it will be of no use. So as soon as possible, the victims over there, the people who are stuck up, who are the, you can say, bearers of that particular disaster, they should get immediate help. They should be immediately relieved from that situation. Assessment of damages and intensity of the disaster. Not only the immediate help, but what danger, what harm is caused in that particular area, that has to be assessed. Because there are certain vehicles and all whose insurance policies and all are carried out. So through the different insurance companies, after assessment they get the benefits. Arranging for rescue work and help to rescue the people. Rehabilitation and rebuilding, very very important. Only by providing present help or some amount of help to the victims won't work out. The people should get some permanent you can say option or a permanent way to come out of that disaster, which can be, you can say, done only through rehabilitation and rebuilding. Some of the people, they might have lost their houses, they might have lost their valuables. So how to rehabilitate the people, that is the main work over here. Now our next topic is very very important: first aid to disaster victims. What do you mean by the term first aid? First aid means the immediate medical help which are given to the disaster affected victims. On the spot, the help by including some part of medicines, bandages, that help which is given to the people at that particular instant to minimize the loss, of lives, that is known as first aid. So what is the main aim? What is the main objective of this first aid? It is prevention of death, preventing deterioration of health, and starting the process of rehabilitation. The disaster affected victims, you have to first see that how the loss of lives of the people can be minimized. Next is deterioration, means lowering down of the health. The lowering down of the health of the people should be reduced immediately, so that all part is achieved by first aid, by providing first aid. So only by speaking first aid won't do. It is very important for us to know about the emergency measures or the first aid practices which have to be followed. So the basic principles of first aid we are going to study here, that is life and rescue citation. ABC is the technique, it is the short form. Now what do you mean by ABC? One by one we are going to see. A stands for airway. Airway. You breathe in through your nose. So if the victim has difficulty breathing, this can take place if the people are stuck up in the water, in the floods, or if a building has caught fire, then people who are stuck up in that fire, after they are relieved, the victim can suffer from difficulty breathing. The head should be held in a backward sloping position, or the chin should be raised so that the respiratory passage remains open. You can see in this picture how the chin of the victim is raised. So what happens if the patient has difficulty breathing, and if the breathing goes on, the process goes on lowering down, the patient's health, the victim's health will also be deteriorated. So to prevent that, this technique has to be followed, that is airway. To take the head of the victim, and it should be held in a backward sloping position, or the chin should be raised. B stands for breathing. If breathing has stopped, the victim should be given artificial ventilation by mouth-to-mouth resuscitation. What do you mean by resuscitation? What is done in mouth-to-mouth resuscitation? Here, it is the act of assisting the respiration. The breathing process has stopped, but the patient is still alive. So here the rescuer, the person who is rescuing the victim, that rescuer presses their mouth against that of the victim, and he blows air into the victim's lungs. From his mouth, he is giving the breathing. He is forcing the air into the victim's lungs, which are stuck up. Somewhere the respiration process has stuck up due to that disaster. Third is circulation. If the victim is unconscious, you can say likely that the victim can become unconscious, then after giving mouth-to-mouth respiration twice, the heart should be pressed down hard by pressing the chest with both the palms. Here the patient is not a doll or a non-living thing whom upon you can practice. So you should be thorough. This technique you should know. And if you know it in a very proper way, then only you have to try it on the victim. Otherwise, the victim's life can also be lost. So do not try any type of techniques which you do not know. These two actions should be repeated alternately about 15 times, which is known as cardiopulmonary resuscitation or CPR. And really it helps to bring the circulation back to normal. You know about the blood circulation and all. So that process, if it is stuck up due to CPR, it helps the victim to be relieved and bring the circulation back to normal. So this is the ABC technique: airway, breathing and circulation. Now let us see in different small you can say disasters what help should be taken. If you can see that the victim is bleeding heavily, if the victim is injured and bleeding through the wound, then the wound should be covered with an antiseptic pad and pressure applied on it for 5 minutes with either a palm or your thumb, so that the bleeding at that particular place stops. The wound should be covered with an antiseptic pad. Do not use any types of cloths or rags which are just lying around, because if the victim is bleeding means somewhere the wound is open, and if your rags and all which are used to cover it are infected with different types of microbes or insects, then the infection will spread to the victim. Fracture and impact on vertebrae. You know about the fracture. So if any bone is fractured, then it is very essential that the fractured part be immobilized. The part should not be made to move. It can be done with the help of any available wooden rods, batons, rulers, whatever things are available. All the medical assistant things will not be present there. So whatever things you see around, that should be used. If there is an impact on the back of vertebral column, then the patient should be kept immobile on a firm stretcher. Now stretchers and all you will not get which you see in the hospitals. For stretchers, if you see any cotton bed sheets and all which are lying around, that you can make use as stretchers. Next is, if you see that the victim has faced any burns, then if the victims have burn injuries, it is beneficial to hold the injured part under clean and cold flowing water for at least 10 minutes. Please, if you see the victim has any burns, then many a times you cover the wound. Don't do that. First allow the wound to get cleaned by just holding it under your clean tap water. Here also you have to take care to see that the water is clean. Now the rice technique, the rice remedy in the case of injuries like sprains, twisting and contusion. The rice remedy, what is that rice remedy we are going to study? Rice, R from rice stands for rest, I stands for ice, C stands for compression and E stands for elevate. Rest, allow the victim to sit in a relaxed position. First thing is that after a disaster, the victim, the patient is mentally and emotionally, you can say, very tired. He keeps on thinking about the situation. He keeps on thinking how much wound he has suffered, where his near and dear ones are present. So first thing is that the victim should be allowed to sit in a relaxed position. In the case of injury like sprains and all, apply an ice pack to the injured part. Compression. After the ice pack treatment, the injured part should be massaged gently. Gently word is very important. Do not massage very roughly. And elevate. The injured part should be kept in a raised or elevated position. Why? So that the circulation of blood becomes normal. So this is the rice technique or remedy. Rest. Ice. Rest means allow the victim to rest properly in a relaxed position. Ice, application of ice pack to that injured part. Compression. After the ice pack treatment is over, the injured part should be massaged gently, and E stands for elevate. The injured part should be raised or kept in a elevated position. Now, how to transport the victims or patients? The different techniques one by one, very you can say quickly we are going to see. You know that the victims have to be shifted from the actual place of disaster to a safe place or shelter. So different techniques have to be used because the victims cannot run or walk on their own. So depending upon the amount of, you can say, injury the victim is suffering from, the different techniques have to be carried out. So the first technique is cradle method. You can see here the child, the victim is taken, the cradle पाळणा जसा म्हणतो, which is useful for children and underweight victims. This cannot be used for heavy people who are having heavy weight or adults. So for children or the victims who are having who are very thin, for them to transport to a safer place, this cradle method can be used. Carrying piggyback. You can see here the victim is on the back of the rescuer. So useful for carrying patients who are unconscious. Here if the patient is unconscious, then the medical help has to be given to the patient at an immediate level with emergency. So the patient cannot walk, the patient cannot move. So by carrying the patient or the victim on the shoulders, that is called as carrying piggyback. Human crutch method. If one of the legs is injured, the victim should be supported with minimum load on the other leg by giving help. Pulling or lifting method. This is used for carrying an unconscious patient through a short distance. By just pulling the patient, as I have told you, the patient won't be able to move if he or she is unconscious. Carrying on 4-hand chair. Here you can see the 2 and 2, 4 hands are made here like a chair. This is useful when the support is needed for the part below the waist. Carrying on 2-hand chair. Here the chair is made with the help of 2 hands, useful for those patients who cannot use their hands but can hold their body upright. Methods used by the fire brigade. Here this cannot be used by you. Stretcher. In an emergency, if a conventional stretcher is not available, as I have told you, the stretchers and all which you get in the hospitals will not be available over there. Then how you can prepare a stretcher? It can be made by using bamboos, blankets, etc. So whatever things are available there, you have to make use of it, and you have to see that the victims face minimum loss. Other emergency techniques or other emergency measures which are used are boats, which are used by the civil administration to rescue the people trapped in flooded area. As an emergency measure, wooden boats, bamboo floats, air-filled rubber tube from a tire, they can be also used for people who are victims of floods, tsunamis and such other types of disasters. So this was a very interesting chapter where you could learn different techniques. In our school also, different types of techniques were taught to you. Earlier we had our life-saving skills lectures, through which different types of disasters, what are the types of disasters, what is the intensity of the disaster, which help you can provide, which help you can take, how you can save your own lives and other people's lives. That was taught to us in the school through the life-saving skills lectures. So here through this chapter also, you are now aware about the small techniques which you can use. First, in the case of bringing or lowering the amount of solid waste, making other people aware about it, encouraging and motivating other people to follow it, and during disasters, how you can provide assistance or help to the victims, or if you are a victim, then how you can tell others and how you can get yourselves helped by others. So if you know, if you read properly, and this is the chapter where you can write maximum of the answers on your own. You need not write everything which is given in the textbook. So here our 9th chapter is over. The discussion of textual exercise, additional questions and activities will be provided to you after the vacation. Now Ganpati vacation we are having from tomorrow. So a happy Ganpati vacation to all of you, dear children. Enjoy the Ganpati vacation by following social distancing, because still the pandemic is not fully over. Other people are avoiding masks. You are literate, you are educated in NGV. So we should know that mask can lower down. You cannot say by wearing mask you will not be prone to COVID, but it will lower down the chances of you getting affected or infected. So make use of masks whenever you are eating. You are going to some Ganpati visits and all, so prasad and all which you get, see to it that immediately you are not eating. Carry a small plastic, you can say, tiffin with you, and whatever prasad and all you are getting, you just accumulate together in the tiffin. After coming home, you can wash your hands and all properly, and then only you can eat it. Then next is, I have told you, follow the social distancing. Keep distance of at least 1 meter between two people. So enjoy your vacation in a very proper way. So when we meet after the vacation, all should be very healthy, and we can also concentrate well on our studies. So in the vacation also, after 2 or 3 days of the Ganpati, then you can just sit at home and concentrate on your studies. See to it that this time you are utilizing for your completion of leftover chapters and all. So completion of the books, studying, all that part you can do it. So till then, a goodbye from my side. Stay at home, stay safe. Thank you, dear children.